shape is like this. It's like an oval. Okay? Why didn't it say oval? I don't know. Radiologists are funny like that. They use really big words. What's this guy got? What? You're guessing what? Abdominal bleed? Possibly. Where are you getting that from? Where did you get the bleeding part from?
I just assumed.
You just assumed he's bleeding.
Because we're talking about this.
Okay? Okay, so yeah, this would be an abdominal aortic aneurysm, like so. Okay, doesn't necessarily mean he's bleeding at this point. Okay? However, that is a really, really big mass. That is a fusiform shape. That is a fusiform shape, as in an oval shape. Okay? This is obviously a problem because to have an aneurysm of any kind means that there's a weakened wall in an artery. Okay? If there's a weakened wall in an artery, it can puff out, kind of pops out, right? If there's a weakened wall in an artery and it pops out, it can bust. Okay, obviously, if this thing busts, old Steve has a major problem, right? Because this is the aorta once it hit the abdomen. Okay, so major problem if this thing explodes. Steve is going to make it, probably. Unless you happen to be standing next to trauma surgeon, I guess, with all the tools. Okay? You notice in this case study, we're talking about an abdominal aortic aneurysm, or AAA. Okay? I gave this guy hypertension, that's HDN. Hypertension, just get used to writing that. Hypertension is too long to write, so nobody does. Okay? Smoking, put that on your list of, yeah, it causes pretty much everything. Okay? 4,000 chemicals, every pathology almost is part of it. Okay? Anybody know what Marfan syndrome is?
It's a genetic disorder.
It is a genetic disorder. Yeah, you're really long limbs and fingers. They have really bad arteries, right? They're very stretchy. They say Abraham Lincoln had Marfan's. They're really tall, like spider-like fingers, very long. They say. I don't know if you guys can do this. It's a connective tissue disorder. I don't know if anybody like take their finger and stick it right on their wrist.
What? Oh my.
No! Hey, stand up. Hey, stand up. You gotta show everybody that. It's awesome. Come on. We like to get that on video. I can't see it.
Here. Oh my.
That's
That is great.
I can't get past right here. Someone got mine.
All right, so that's pretty awesome. You know, pretty awesome party tricks and stuff. However, that does, I'm not saying you have Marfan's, I have no idea if you have Marfan's. That does make your arteries stretchy too. And if you have very stretchy arteries, they can balloon out when you have high blood pressure, okay? Does that make sense? High blood pressure, you find the weak spot, boom, pops it out, okay? If you look at these signs and symptoms down here, I pretty much put most of these. What did I put in that case study? I basically just listed these and made a case study out of them, right? What didn't I put? What's missing? Oh, NV is nausea and vomiting. Again, get used to that one. Nausea/vomiting takes too long to write. You will never see that in a chart. Huh? Everything's nausea and vomiting, right? HA is, again, headache. Ha. What? Okay, that one, altered level of consciousness. Okay, because you have increased intracranial pressure. Okay, if this thing does not pop, oh, where are we at? You guys moved on the brain on me already. I'm still talking about the abdominal one. Okay. I didn't put anxiety in there, but people that are having these aneurysms, pretty much regardless of where they are, they kind of know something's wrong, right? And they'll get very anxious. A lot of times they think they're having a heart attack, or they just know that there's something wrong. Okay, and there is, clearly. What? Well, when it bursts, they don't really have a lot of time to think about much. Impending doom. Yes.
Sure, that would cheer up the patient. I'll give him impending doom.
They don't tell you though. They're like, I have impending doom.
Yeah, I have impending doom.
I feel impending doom.
No, that's a very classical thing that people in healthcare will say. They will have signs of impending doom. They kind of know they're hosed. So yeah, it kind of freaks them out, as it might. Okay, so the other one, the berry aneurysm that you guys moved on to without me.
Hold on, sorry. Before you move on, is the back pain what you were trying to get to?
I did mention back pain.
That one's big one, isn't it?
Yeah, that abdominal back pain. Again, look at the size of that sucker. That thing is pushing on something. Okay? Remember, despite what we may make you think in anatomy, all spaces in the body are virtual spaces, as in they're either filled with something or they're collapsible, right? Well, when you have something like that should not be there in the first place, it's going to push on something and that hurts. If it actually dissects, if that aneurysm actually blows, then you're starting filling up your abdominal cavity real fast with a lot of blood, okay? And that's gonna hurt. That's gonna put a lot of pressure. And you're gonna die, but.
Thanks.
Ooh, we got a story. I'm gonna go back here so she can tell it louder.
Okay.
Okay.
So I work at the hospital, and we had this, I think he was 65-year-old patient come in to the ER complaining of abdominal back pain, heaviness in his chest, and they did a CT. They did a 3D CT, and he had an aortic dissection all the way from the top of his aorta all the way down his abdomen, completely dissected, and 3 centimeters away from the end of the dissection was an aneurysm the size of an orange. So we were all like, ran in there and we're like, whatever you do, don't move. Like, we couldn't let him move. We had to like carefully transport him like straight to the OR.
Wow.
It was crazy.
You live.
Well, I don't know that because I didn't get to see him. I know I didn't get to see him post-op, but it was his whole entire abdomen was dissected with an aneurysm right next to it.
So like she mentioned that he had back pain, so that's a really big indication during aneurysms or abdominal back pain.
Cool. Okay. So again, glad you guys have the story, you know, and obviously they have that in here too, because we're not making you memorize stuff, right? Also, you know, going straight into school and a lot of you are going to be in clinics, and depending on where you are, they may give you some responsibility. Okay, so I mean, this kind of stuff that you need to know. It's not just about memorizing things at this point in your life. Okay?
Yeah, so like sometimes nurses do differential diagnoses. I don't know if you went over that before.
I don't think I did. They tell you you're not supposed to diagnose this.
No, but
Nurses
like-
do differential diagnosis
Yeah.
all the time.
Nurses will have like a couple things they think it might be, and then when the doctor, either if they ask for something from the doctor, or if the doctor comes in, they tell them like what they're seeing, and they might focus their assessments to those diagnoses that they believe it is. So they're not diagnosing the patient, but they have an idea on which one it might be. But then as a nurse, you're not going to say, oh, it's that. So you have to have an idea of what it could be, and the doctor's going to go ahead and diagnose it based on your assessment or what you're seeing, as well as their assessment.
Yeah, I might have mentioned before, if you're a triage nurse, you're pretty much making unofficial diagnoses
Yeah,
all
like a
day
heart
long.
attack.
Yeah.
Like heart attacks, those are really, I mean, like he already mentioned, if somebody complains of chest pain going into the ER, the nurse has to know, okay, well, this could be a heart attack, so they're gonna go ahead and treat them differently.
So, Berry aneurysms, okay? If you look at this Berry aneurysm, they call it berry, again, all aneurysms kind of look like a berry, right? I mean, they're popping out. This tends to hit right there in the circle of Willis in the brain. If you remember your anatomy, you flip the brain upside down, you're looking at your carotid arteries, and then they turn into the basal artery, and then they kind of hit that circle of Willis. You can see right here there's one, but that's a pretty common place to have an aneurysm in the brain because there's just a lot of pressure, and when it starts splitting off, that's where there's going to be a lot of pressure hitting. Obviously, that's a problem. Okay. If that thing ends up, I mean, even if it doesn't blow, it's going to hurt because there's very little space in the brain that you can have things growing before it starts pressing on nerves and hurting real bad. Okay. If it does blow, obviously that's a problem because now you have it bleed inside your brain or inside your skull, I guess. And there's nowhere for that blood to go. So it's going to cause increased intracranial pressure, and that's what I was talking about down here. Increased ICP, increased intracranial pressure, internal bleeds. It will alter your level of consciousness. Okay? It will make people pass out, go into coma. You can't have a lot of pressure inside your cranium because that skull is not going anywhere. Okay? All of these other things, oh, yeah, that reminds me, headache. Did we talk about that before, about the worst headache in my life?
Mm-mm.
Not my life. I have headaches all the time.